Hi, I'm Sabine, and you need to get a fibroid checkup.
And that's on period, sis. Hey, y'all. I'm Mandii B, your host, and this is another episode of Period, Sis. Today, we're talking about fibroids and the importance of adding an abdominal ultrasound into your annual checkup with your doctor. Now, I personally have a ton of friends dealing with this, and today I am joined by 49-year-old Sabine, who's been dealing with fibroids and infertility since the age of 32. Sabine, thank you so much for joining us here today.
Thank you for having me.
Because you made it here, and apparently you went through a whole lot. So, but before we start, introduce yourself to our audience, and then let us know the turmoil of you coming here today.
Thank you for having me. My name is Sabine, and on my way here, I'm with my husband in our van, and we were driving on the Williamsburg Bridge, and one of the cameras that I guess like records traffic and all that literally fell from the railing or above railing and hit the van.
Oh, so it fell on your car?
On my car, literally on the van.
Now, I ain't a lawyer, but I would love to represent you in this case. Everyone's okay? Your car's okay?
We're okay. There's some front damage.
No. See, we have to work on this. Actually, no. You're in pain. You are hurting. We gonna scratch that out.
Well,
I got to tell you how to respond to this question.
I can't do too much because I'm here.
Okay.
I made it here.
Okay.
Because I literally called 911 and I was like, I have somewhere to be. Like, I can't sit here and wait for you guys. I need to be on time. So we left.
That makes me feel so special that you made it here.
However, I have the camera. I took the DOT cameras in my van.
Okay, now we have to decide if we're going to make more from the state of New York or selling that camera. We're going to figure it out. We are going to figure it out. But today we're here to really dig into your story. And what's crazy is this, I know y'all are probably sick of me saying that this topic is near and dear to my heart. But this is actually something that I was sharing with the staff last night. Almost every single one of my friends right now has fibroids.
Wow.
This is a conversation where I have a friend who has gone through multiple surgeries. I have another friend who thought she was just bloated and getting big, and no, she went in and it's the size of, right now, not a grapefruit yet, which is why they're not removing it. I've literally, my friend who beat breast cancer just let me know, yeah, I have fibroids too. What? So let's start with, I guess, did you have a quote unquote normal period? Kind of what led you to going to the doctor and getting this diagnosis?
Well, I can tell you, my first period I got when I was 12 years old. Never had any issues with my period. My period has always been short, never really heavy until literally till I was about maybe 28 years old.
Okay.
Then it changed a little bit. But
what changes happened?
I moved to New York. I'm from Miami.
Okay.
So I moved to New York. I had just graduated from college. I was in graduate school. Just the change. So I took it as that.
You took it as environment, stress, life. Okay.
Exactly. So once I got engaged at about 30, I got engaged, and we were like, let's, look into having kids. But I always did my regular checkups. The doctor would always ask me the regular questions, are you okay? And I'm like, I'm fine, a little heavy bleeding, and I would leave it at that. But when I turned 30, the periods just started getting a little heavier and longer. My period cycle is 4 days. It started going past 7 days, and it was heavy to the point where I'm changing pads maybe every 4 hours. But I took it as nothing, but I discussed it with my doctor.
Right.
And he was like, I want you to go for an ultrasound. And I, because I'm me, kind of like just brushed it off. And I was like, when I get to it, I get to it. But he had recommended an ultrasound, which is one of the first ways that you could find out about the fibroids. So there's that. But what made me do something was I was at work, and I had just gotten my period, maybe like I want to say the night before. I was at work. I was sitting on the chair like I'm sitting right now, and I'm talking to one of my coworkers. And you know that gush feeling that you get?
Girl, I've been feeling it the last 2 days.
So I got the gush, okay?
But it felt different.
Yeah, this felt different. And I was like, did I just dirty my clothes? So she looks at me, and I look at her, and I was like, I think I just dirtied my clothes. So I get up, and I put my hands on my butt, and I look at my palms, and there's blood. And I was like, oh my God. So she's like, Sabine, And I would like went into tears, and she's like, just go to the bathroom. So literally, I pick myself up, go to the bathroom. I'm literally taking a shower, doing laundry, everything in the bathroom. Because at that point, things were coming so quickly. So I literally walked around with extra Kotex, extra underwear, and a change of pants. I was there already. But I was like a little scared to figure out what it was.
Right.
But after that happened at work, I was like, all right, I need to go to the doctors and go get that ultrasound and find out what's going on. And that's how I found out that I had about 7 or 8 fibroids. And
so wait, you did your yearlies, and everything was coming normal.
right,
Everything was coming back normal. So the only way you could have known that these fibroids were there was through the ultrasound.
Correct.
Which isn't given during a yearly.
no.
Unless something is abnormal.
Exactly. You have to ask for it. You have to kind of push for it. And that's something they could do in the office.
I'm not going to lie. It's so crazy that has not been added, especially
Right.
for Black women,
Exactly.
as just a part of our yearly.
Right.
Wow. Okay.
This is one of the reasons why I wanted to be part of this conversation, because I found out, because my doctors told me to do it, and I was like, whatever. Now I'm like, this needs to be part of your conversation with your doctor.
Right.
When you go, if things are not feeling right, you need to advocate for yourself, and you need to make sure that they're doing something, because it could be done in the doctor's office.
Right.
They could do the not transvaginal, but they could do the abdomen, and they can
see it from there.
You got it.
So you get the ultrasound, and they say you have 6 to 7 fibroids.
Yes.
But what does that conversation look like? Because many women are told they have fibroids, and they're like, but you're still fine. So being told you had 6 to 7, what was in the conversation?
Well, he asked me, my OB sent me to a specialist in Manhattan, which I was so unfortunate. I was his last patient. I cried that visit because he was retiring right after me. But he was like a fibroid specialist.
Okay.
His name is Dr. Sandler. So I sat there, me and my husband, and he went into detail of like exactly what a fibroid is. Because I told him, he asked me, do you have urgent, need to go to the restroom? And I was like, all the time. He goes, it's the fibroid pushing against your bladder. That's why you have to pee every 15, 20 minutes. He goes, it's not just, that's why. And he goes, do you have pain if you have sex? And I was like, yeah, sometimes. He goes, that's the fibroids.
Wow.
He goes, do you have bleeding periodically on and off throughout the whole month? And I said, yes. He goes, that's the fibroids. He goes, all those things are the bloating in your stomach. That's the fibroids. The little pressures that you may get like a little zing here and there. That's the fibroids. So he educated me a lot, but it also scared me. So because I felt like I got to do something more just for my life to be regular.
Right.
So that's why when he recommended surgery, I was like, that was my first surgery. I was like, okay.
Did he recommend surgery because you had all of those ticked boxes?
Yes.
Okay. So you were actually experiencing the symptoms from it.
Yes.
Because so many women do have fibroids. And if there's no pain, if none of those boxes are ticked, they're like, well, just come back every 3 months and get them checked, because if they grow to a certain size, we would recommend removing.
Exactly.
But as long as you don't tick those boxes off, you're fine. But you had all of that.
Yes. And it's something to also be mindful of. There are certain, even though you have fibroids, they're non-cancerous.
Right.
But my OB, which I said I've always been lucky in that aspect. Every GYN that I've had, they're aware that I have fibroids, and I educate myself. There's a test that you should be getting done yearly with your PAP, if not during your PAP or right after, where they will take a piece of the fibroid and check it for cancer.
Oh.
Yes, I for the life of me, I can't remember what it's called, but it's something that I really wanted to make a point that I talk about today.
Okay.
Because a lot of people don't know about that test, because it's not something that's talked about as well.
And if you stay tuned, we'll make sure to find out the name for that test and include it in our stats and facts.
Please.
Yes.
That's something, because every year when I would go do my PAP, no matter which, because I've been through a couple of doctors, I would ask for it. If they didn't talk about it, I would talk about it. Out of the 7 doctors, only one that I had to kind of like push a little bit for. Everybody was like, oh yeah, okay, let's do that.
Okay,
So,
good to know.
but it's something that I encourage women to get.
You have your first surgery.
Yes.
They came back.
Yes.
Did you find out they came back because you started experiencing symptoms again? Or was it just through your quarterly maybe checkup after? Like, explain how you got rid of them and then they showed back up.
Yeah, it was the symptoms coming back.
Okay.
And then the not getting pregnant.
Okay. So you were actively trying
Yes,
to.
I've been trying. I am 49 years old, and I've been trying to get pregnant since I was 33.
Wow.
And I've had 2 miscarriages. But in that space after the first pregnancy, I knew that I was still ovulating, I was still regular, everything was still kind of normal, but just couldn't get pregnant. And I'm like, why?
So were the fibroids to blame as well for the miscarriages?
Yes.
And how were you told about that? Like, how did that become the conclusion?
Their fibroids are putting too much pressure on the fallopian tubes.
Okay.
So that was one of the issues with my egg being released in time. And then where the fibroids are positioned in my uterus, they were kind of like smothering the embryo, so it wouldn't grow. It couldn't go any further, so it would just kind of like disintegrate and kind of die out by itself. The 2 miscarriages that I had were based on that.
So you end up having more surgeries and a procedure.
Yes.
Can we talk about what the difference between those are, as well as just what fibroid removal surgery entails, and the recovery of it as well?
Well, they have laparoscopic surgery, which is basically with a robot where you'll get some incisions through your abdomen.
Okay.
So that's not that bad. The recovery is about maybe 4 to 6 weeks, roughly about a month. But the recovery time is up. You're able to walk around, and again, it's not as invasive as being cut.
Okay.
So it's a laparoscopic myomectomy. Now, an abdominal myomectomy is literally like having a C-section. So you are literally cut from one end to the other, where they would take out your uterus and take out all the fibroids. That I've done twice. And that recovery it's about same thing, about 4 to 6 weeks, like if you just had a baby.
But that one you're kind of immobile for a little bit.
Yes, you need help. Like it really knocks the wind out of you, because even because I had an abdominal myomectomy in February this year.
Oh wow.
So it has been a struggle. The last time I did it, my mom was here. So my mom was able to help me out and help take care of me between her and my husband. This time it was just him, but he got to work. So it's like to manage by myself, the walking, the going up, down and stairs and catching your breath. And it's a lot, because I had to like keep telling myself that they cut you open and they took out the uterus, but they're also picking at the uterus to take out the fibroids.
Oh, and then putting it back.
So when you think about it, because I told him, I'm like, why am I not feeling better? Like it's been a month,
right?
And I'm still struggling. And he's like, Sabine, we cut you open and then we took out, because this time they took out 11. So they took out 11 fibroids. Wow. He's like, that's why you need to give yourself a little bit more time and a little bit more grace, because it's not just like having a baby where they just cut you and take out the baby and put it, and that's it. They like took you out and we're picking at it and taking stuff and doing, and then we sewing it and then we put it back.
Oh my.
So he was like, that's why, just give yourself some more time. So tomorrow will actually be 2 months, and I can sit here and tell you this week has been a good week. Like I am feeling better.
Outside of the camera falling.
Outside of
the goddamn camera falling.
But I am feeling better.
2 months later,
yeah.
How does your partner support you during the recovery?
I can tell you, it has been a struggle for him to watch me go through this. And in the beginning, it was hard for him to understand, because I can tell you right now, we got maybe almost like maybe about a year before all of this kind of came into effect. At the very beginning, he couldn't understand, like when I would say I have pain, like I don't feel well, like this is bothering me. Sometimes he thought I was like, because I didn't want to have sex. So he would be like, "Are you, man, look." And I'm like, "But no, like for real, I have pain." Or I would literally sometimes have to stop during sex and be like, "I can't, like you can't, like this ain't gonna work."
It just wasn't enjoyable.
No. And I'm like, we would try different things and I'm like, it's not working, bro. Like it's just not.
And I was gonna ask that. Have there been, with battling the pain of the fibroids, has there been any position that does feel pleasurable?
It depends on where they are.
Okay.
I can tell you that.
Okay.
So, but he has been as supportive as he can, and moving now, because this has been going on, like I said, for 16 years. We've been married for 16 years. We've been together for 22. Wow. So he is now like fully aware of what's going on. He is there at the doctor's appointments. He is there amazing. Advocating for me. He will curse anybody out if they give me attitude, which I appreciate a lot. But he is like front and center with how are you feeling? What's going on? Are you in pain? Are you okay? He is constantly. Sometimes I get, it's like I feel guilty
Why?
because I want him to just, first of all, I want him to stop asking me that. But I know that he, if you were with someone else that was just like normal, that has been a back and forth thing with me because we don't have any kids. And I know that it's me. So it's sometimes I have that guilty feeling because I'm like, I want to have sex with my husband and I want to do this with my husband, and I'm like, I can't do that right now. Like, you got to give me a minute or come back tomorrow, or I got to take a pill to alleviate some of the pressure that I'm feeling for us to do
Wow.
something.
So 16 years battling fibroids and having surgeries and procedures to remove them, and they keep coming back.
Yeah.
Family planning looks like what now?
Well, right now, I did say I'm 49. It is the last 3 years I was actually able to finally be able to afford something.
Okay.
So that was a big thing. But I found a fertility clinic called CNY Fertility. They have
Okay.
3 different offices upstate New York where they do surrogacy, egg freezing, embryo transfers, embryo storage, freezing, and so on for a great, wonderful price. I would say
Okay.
anybody that wants to do anything, and they will accept you at any age, any weight, anything. They are open to wherever you are, whether you are having a cycle, not having a cycle. They will get you where you need to go if you want to have a baby.
Now, are there any programs that assist with the financial cost of it?
Within the CNY,
Yes.
within CNY, yes.
Okay.
So they have payment plans, they have all that wonderful
Amazing.
stuff. So within the last 2 years, I've been able to work with them to actually do an egg retrieval. And
Okay.
I have an embryo.
Oh, wow.
So we have been, me and my husband have been working for like a year to make sure that my body is right for us to do the transfer, since it's only the one embryo we
Yes.
have. Because I did not want to do surgery anymore. I could tell you that right now. But the team that I have right now with me, they take such good care of me that I trust them with anything they say.
Now, I wanted to ask you this then, with being with your husband for so long and trying and experiencing the unfortunate miscarriages, at any point, did you consider egg freezing earlier? Or at least to make sure you had that option later, knowing that you were battling with this?
Honestly, it was something that I looked into a little bit, but I know it was something that I didn't think it was something we could afford. Let me say it like that. So finances and costs was really a big issue of
Okay.
why it was put off so long.
Okay.
And why we were kind of just trying to see what we can maneuver with it. Like, I'm Caribbean. My parents are from Haiti. So everybody was giving me a tea to drink, a tonic,
They said, let's herbalize this.
Right. So I was getting stuff, and my husband is Dominican. So I can't even tell you how many
Oh my God, the
things,
soups, the teas, the drinks.
to try to alleviate things. And it's funny because I want to say about a good maybe 60% of it worked. Like, I would feel better.
Oh, wow.
I would go through, my cycles would be lighter. I would feel better. But that getting that pregnancy that would stay was never something that was like it just didn't come to fruition.
And so the IVF process, before we get out of here,
Sure.
I haven't really got to fully dive into what that process entails. So you look up the prices, you clearly find
Yes.
a facility that can take you from step A to Z.
Yes.
What are those steps, and what do those conversations also look like?
I have a doctor here in New York, because the office that I go to is in Albany that monitors me.
Okay,
And
that's like 2 hours.
Right, right, roughly. So the doctor that monitors me here, I basically do blood work, ultrasounds with him, and he just keeps track of my labs, and he's the one that writes my prescriptions
Okay.
for estrogen, progesterone, whatever medication you need. Because the first step is to check out your hormones and make
Right.
sure that your uterus is viable for embryo in the first place, which we did all that.
Okay.
Then there's the medication to actually get you to produce as many eggs as you can to get you ready for the egg retrieval.
Yes.
Which I was not giving myself shots. So my husband was like watching videos. We called
Hey,
the doctor.
he gave them to you?
You sure did.
I know,
And
that's
then-
right.
And then
Shout out to that king.
But our doctor was available, which I love, Dr. Brandeis. He was available at 1:00 in the morning, prepping my husband on FaceTime on how to give me the shot in my butt. And when we did the trigger shot, which is right before you do the egg retrieval, it was 1 o'clock in the morning, and we were like, he's like, Dr. Brandeis, and getting the needle right. And he was like, you got to do it right now. Because when you do those trigger shots, it has to be on time at that moment to make sure all the eggs get released at that time, which we did. So we were able to get 4 eggs. 3 passed away within a couple days. And then I got the one egg.
You got the soldier.
You got it. And then they put when we go to Albany, they were able to do the egg retrieval, do the embryos, and I had the one embryo that they froze for me. So why we didn't do, because we were going to do a fresh transfer. A fresh transfer is what happens immediately. Like, you do the egg retrieval, within 3-4 days, they do the embryo transfer, just like that.
And then put it back in.
And put it back in. But I had a delay because I had an issue with liquid in my uterus, which is a whole nother issue. So it was been delayed, and then the fibroids were acting up. So the doctor was like, I don't want to do anything. So we ended up freezing the embryo. But because my fibroids are on the outside of my uterus now, the doctor was like, Sabine, if you get pregnant and the baby, is growing, and you're going to be in so much pain and you're going to have so many issues. So they were like, we have to take them out before we can do this transfer. And that's why I did this last surgery.
The one in February.
In February. To take them out.
Wow. And so when are you planning to do the insertion?
I would love to do it in June or July, but I'm scared, 2, because I know everything is clean now. Like, I am good to go. So I'm a little paranoid, but I also want to listen to my doctors. Like I said before, I have a really, really good team. They listen, they know my body, they've seen it in and out. I trust them. So if the 2 of them, my GYN and the fertility doctor, tell me go, I'm going.
I just want to say I love that we have this parallel happening. We have so many stories where people are like, they don't listen to me. I didn't feel safe. Right. And you're like, this team is the team that's going to take me past the finish line.
And they tell me that all the time.
I love that.
And the fact that I just want to say, because I'm 49, I've had a lot of back talk about my age, about why'd you wait so long, or why do you want to do this now? Your kid is going to be 20 and you'll be 70, and I'm like, I can't look at that. I want to have my family, and the team that I have now, they support me with that.
I love that.
And I also want to just say, I have also been in therapy, because mentally it's been
this is a lot.
It's a lot
psychologically for you to deal with.
For
you to even be blaming, kind of yourself now.
Right.
Knowing that you're in this marriage and want a family build, but you say it's your fault while you're not, So it's therapy.
Yes. So between the therapist and my team now, I'm good to go.
Sabine, before we get out of here, what advice would you give to someone who has gone through fibroid removal surgeries or is battling fibroids as well as fertility right now? What advice would you give to them?
I would tell them to just keep advocating for yourself. And if you're not sure where you want to go with it or what you want to do with it, talk to people, reach out to people that are I don't want to say like-minded like you, but within your age group. Because one of the things that helped me was finding a group of women who are in my age group who are doing the same thing I'm doing.
Right.
That helped
Community
me a lot.
is so important.
Yes. So, but just remember to advocate for yourself. And if you're not sure where you want to go, take a minute and figure out what you want to do with it. Do you want to have a kid? Because there's also surrogacy. There's adoption. There are other avenues that you can do. You don't have to do the IVF.
Right.
So, and just educate yourself as much as you can, but advocate for yourself. Advocate for yourself.
Sabine, thank you.
Thank you.
Thank you for sharing your story.
Thank you.
And again, I just know that this is going to touch so many people.
Thank you.
Again, I know all of my friends literally are living and battling fibroids
Thank you.
early.
I
know. So again, advocate for yourself. Also, make sure you stay tuned for Stats and Facts. We're going to be right back. Sabine, thank you.
Thank you for having me.
I am so glad that Sabine sat with us today to share her story on fibroids and infertility, and much luck and success to her IVF journey. Now for Stats and Facts, 70 to 80% of women will develop fibroids by the age of 50. Now, fibroids is most common for Black and brown women compared to women of any other races. And women who are overweight or obese may have a higher risk of developing these fibroids. Some symptoms, like Sabine said on the show, include heavy menstrual bleeding, pelvic pain or pressure, which can lead to uncomfortable sex. Also, urinary or bowel problems, So hey, when your friends can't hold their bladder, let's not make fun of them anymore. We invite you to add an abdominal ultrasound to your annual checkup because you can really get ahead of possible fibroid complications down the line. Now again, thank you to Bel Air for providing us with this beautiful space for this episode. And again, make sure you please send this video or audio to a friend and help us spread this important information. Also, make sure you rate, subscribe, and review wherever you listen to Period Sis. And make sure you tune into us next week for another episode of Period Sis.